Welcome to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
My name is Roshni Ashik and I'm the current Communication, Technology, and Social Media intern for Spring. Today we have with us Dr. Emily Godfrey in Medicine, and we will be discussing the journal article, Does Lower Use of Academic Affiliation by University Faculty in Top U.S. Newspaper Contribute to Misinformation About Abortion, which you published online in November 2022. Hello, Dr. Godfrey and Emily. Thank you so much for being here with us today. Would you like to start by introducing yourself a little more to our listeners and also summarizing the study in a few words?
I'm an associate professor of family medicine and obstetrics and gynecology at the University of Washington. So I see patients in family medicine, and I provide comprehensive reproductive health care, which includes early abortion services. And I'm also a researcher who has looked at how we can encourage and empower primary care to provide comprehensive reproductive health services so that they can adequately serve their communities. And go ahead, Madison.
Yeah, hi, I'm Madison Miller. I use she, her pronouns, and I'm a fourth-year medical student at the University of Washington School of Medicine. So to give a little summary of our study, we asked three main questions. So first, broadly, what are the characteristics of faculty who are being published regarding abortion? Second, how often do faculty who interface with popular media about abortion disclose their university affiliation? And what we mean by that is, do they say, for example, Dr. X of University Y? And three, is this frequency the same or different from those discussing gun control being a similarly controversial topic or smoking a more neutral topic? And to answer this, we did a systemic review of popular media articles published between January of 2015 and July of 2020 when we started the project. And we found that overall, there were fewer faculty published or mentioned in abortion articles compared to gun control, despite them both being similarly controversial. And of those experts who did publish in popular press, they were much less likely to disclose their university affiliations. And lastly, we also found notable gender disparities in our work. Significantly more men were published or mentioned in popular media, and this is consistent with what other prior studies have done. But for abortion, more women were published or mentioned, which makes sense given that most OBGYNs and folks with public health degrees are women. However, despite being less represented overall, faculty who are women were significantly more likely to disclose their university affiliations.
How do you see abortion in the US and the existing policies around it?
So abortion is a critically important healthcare service for women and gender diverse individuals in pregnancy than any other country that's comparable to us. And the big reason why people are dying in pregnancy is because of the policies that surround abortion. In terms of existing policies, the decision back in June of 2022 by the Supreme Court of the United States that stripped away the federal protections for an individual's right to abortion with their decision Dobbs versus Jackson Women's Health Clinic caused, as a consequence, more than 30 million women and gender diverse individuals don't have ready access to abortion services, which is really an essential healthcare service. And we've learned that abortion is part of the continuum of pregnancy.
Thank you so much. And what are your thoughts on the role of major stakeholders like media, health providers, educational institutions, and government in the framing of abortion?
Well, let's be clear. Abortion is healthcare, and it's provided by licensed physicians and healthcare providers, and not by politicians running for office. And healthcare is deeply private and personal. In fact, there are federal laws to protect people's privacy related to healthcare. So generally speaking, when physicians, scientists, and public health specialists speak about healthcare, it should be in a way that informs the public with evidence grounded in science. You ask about different stakeholders, and I won't go into depth here, but because Madison will talk about it, but certainly media is a common and pervasive source of public health information that impacts public attitudes and beliefs. And so by spreading misinformation, by misrepresenting complications of abortion, and amplifying the voice of politicians who have very little understanding of healthcare, has really been harmful to the public. Yeah, I've been at an academic institution now for 15 years, and certainly university affiliations is a weapon against misinformation because we are actually considered trusted sources in America due to the ethics that we have to abide by as faculty members, and we actually have to be very transparent about our conflicts of interest. So what inspired us to look at the association of use of a university affiliation with abortion is when another co-author, Dr. Alexa Lindley, and I saw a guest essay published in the New York Times entitled "My Day as an Abortion Care Provider." And it was a guest essay that was written by a well-known researcher at the University of Michigan. And we were just sort of shocked that this individual published as an independent individual and did not utilize their university affiliation. And so we wanted to know and really study systematically whether this was the case, whether when our colleagues who are embedded and work at universities full-time, if they're using their affiliation. And so that's kind of where we brought Madison in to help us do this systematic study. And I'll let Madison to kind of describe how we chose our topics.
Yeah, so in thinking about kind of the topics that we wanted to compare abortion to, we wanted something similarly controversial and something more neutral or widely accepted to kind of act as our control. So to kind of help with answering this, based on Pew Research polls over the past 10 years, public opinion on whether abortion should be legal in most or all cases ranged from 50% in 2010 to 59% in 2021. So that was kind of our baseline metric that we were comparing to. In comparison, public opinion on gun control shifted from 44% believing gun laws should be made more strict in 2010 to 53% in 2021. So we thought this was kind of a similarly controversial topic in the US. For a more neutral topic, we chose cigarette smoking because of, there's been decades of research showing decrease in cigarette use. The association between smoking and lung cancer is very well established and well known. And smoking cessation's been accepted as a part of healthcare interventions, and it's covered by most insurance plans. And, there's bans in the US of smoking in public places. So all that together, we thought this was a pretty widely accepted topic.
Thank you so much, Madison and Dr. Godfrey, for sharing this with us. And if I ask you, how do you see your research impacting policy and practice in the present or maybe in the future? Any comments or any ideas on that?
Yeah, great question. I think when we think about the impacts of our study, it's important to have some context. So media is a hugely important source of public health information, and it has impacts on people's attitudes and beliefs. Part of how it does that is through something that we talk about called agenda setting. And that's this idea that the amount of, so to speak, airtime given to a topic impacts how important the public believes that topic to be. And with this, how a topic is represented can impact the public's view on it. For example, with reproducing abortion stigma. So the fact in our study that we found that fewer faculty published on abortion, discussing its safety, its importance as a public health issue, could potentially influence public opinion and contribute to furthering misinformation. The finding that faculty who do publish in the popular media on abortion are much less likely to disclose their university affiliation is important because it makes these faculty appear less legitimate. How it does that is by contributing to something called the legitimacy paradox, which we also talk about in our article. This is something that was coined by Dr. Lisa Harris. And it's this idea that doctors who provide abortion care are subject to stigma and possibly harassment and violence, so they don't talk about their work. And a cycle is created where they don't talk about her work, the silence is perpetuated, and it perpetuates stereotypes about abortion being unusual or something that mainstream doctors don't do. And so then these doctors are marginalized and subject to more harassment and violence, making them even less likely to want to disclose their work. And this cycle continues. So making abortion experts less legitimate contributes to furthering misinformation, reinforcing false ideas about abortion as a choice and not as an essential medical service that it is. So this is hugely important with the recent U.S. Supreme Court decision and the banning of abortion in many U.S. states, as faculty will now probably be even less likely.
And thank you both, Madison and Dr. Godfrey, for sharing about your research findings and like the implications on policy and practice and helping us understand your work more. And before we close, I would really want to have some closing remarks from both of you that you would like to share with our listeners.
Yeah, I just want to say thank you to JCIH for your interest in this topic. We were thrilled to be able to have the privilege to publish in the journal. And also just want to shout out to our co-authors, Dr. Alexa Lindley, Dr. Jevin West, and Erin Thayer, who were just essential in terms of helping us do this work. And of course, I really wanted to have a special applause for Madison, who really led this effort to the finish line. And equally, my call to action for this research is for doctors and healthcare systems, pharmacies, academic institutions to stand strong against misinformation and defend what is good medicine and what is good public health policy for the health of our patients.
And I just want to say thank you so much for having us, for publishing this work. This was a project I started as a first-year medical student, and it's been amazing to see its progression and to be here speaking with you. Thank you so much to Dr. Godfrey and to the rest of our team, as she mentioned, whom I learned so much from during this process. And I'm just so excited to be sharing this work.
Thanks for listening to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.